Good morning, everyone. What a beautiful day in northeast Pennsylvania, Luzerne County, and I have the pleasure of introducing to you what I see as a rising star for our area. State Representative Aaron Kaufer represents the 120th Legislative District. He serves as the Deputy Chair of the Majority Policy Committee and as a member of the House Health Committee. He also serves as one of the co-chairs for the Pennsylvania Heroin, Opiate Prevention and Education Caucus. And I'm going to let him explain this, but this is what I know about Aaron Kaufer, and this is what I want you to know. Number one, his heart belongs to us. And when I say us, it's northeastern PA, and he has a special heart for those that are suffering from the disease of addiction. One time he made a comment when we were at another hearing. He made the comment, he goes, "This is not political. This is personal. Our kids are dying, and it has to stop." I share that with you because we feel the same way. It has been a pleasure to work with Aaron, to do what I can to help his initiatives, but most importantly, I consider him my dear friend, and he's a friend to those that are suffering from this disease. So without any further ado, I'd like to introduce our State Representative Aaron Kaufer. Thank you very much.
Thank you, Mike, and it really has been a pleasure working with you, and I look forward to continuing the work that we've started. In a recent joint policy committee hearing between Republicans and Democrats locally here in Scranton, Secretary Gary Tennis of the Department of Drug and Alcohol testified that in the United States, 129 people die from overdoses a day. In Pennsylvania, 10 people a day. That's 300 people a month. Roughly the size of a Boeing airplane. If we had a plane crashing down in Pennsylvania every month, there would be a public outcry to solve the problem. Today I stand here with the public making the same type of outcry. Don't get me wrong. There are several positive steps in the right direction. The standing order for naloxone, the mapping program up and running for tracking prescription opioids, and the completion of the Drug Task Force recommendations being completed, at least in the PA House. However, it is still not enough. Maybe I have a different perspective because of my age, as I have had a number of individuals that I have gone to high school who struggle with this addiction, and a number of people who have died. Just 2 weeks ago, another person who went to high school with me overdosed and died. I have finally had enough. I'm not ready to go to another funeral. It's been practically a perfect storm. Federal drug and alcohol block grant for treatment and prevention cut by 25%. $11 million cut from the state budget over the last 8 to 9 years, and that's under both Republican and Democratic administrations. A weakened treatment system that leaves people more jumping through hoops rather than allowing people to focus on their own recovery and well-being. The governor has proposed a plan focused on something called the Centers for Excellence, to help with a warm handoff to help people get into outpatient medication-assisted treatment, or MAT. However, a one-day handoff is not enough. It just doesn't cut it for the help we need to be able to provide to individuals battling addiction. On June 23rd of this year, I stood in the state capitol and spoke with over 100 legislators behind me, including the Speaker of the House, the Majority Leader, the Minority Leader, and Governor Wolf himself. We called for there to be a special session of the legislature, which the governor agreed to call at that time. Well, I didn't forget, and it's time to rejoin the calls to combat this, what I will no longer call an epidemic, but what is truly a pandemic throughout our Commonwealth. Governor Wolf, I am calling on you to uphold your commitment from June 23rd and to call the special session to address heroin and opioid abuse. Earlier this year, Ed Gainey, a Democrat from Pittsburgh, and I founded the HOPE Caucus, standing for the Heroin and Opioid Prevention and Education Caucus, which eventually grew to include the Senate in creating not only a bipartisan, but also a bicameral approach to these issues. We've held meetings, traveled the state, and I know that we take this issue very seriously. Now is the time to put the issues on the table and have the substantive discussion that needs to take place. Make no mistake, We're trying to save people's lives here, people. With that being said, I stand here today after introducing 10 pieces of legislation forming a comprehensive opioid package. The bills are numbered House Bill 2321 through House Bill 2330. House Bill 2321 is a reintroduction of community hospital emergency drug and alcohol detoxification, which will encourage existing healthcare facilities to convert beds to provide medically supervised detoxification and create a staging area for people in need of treatment by partnering with our existing hospitals. I want to tell you a quick story on why I believe something like this is necessary. A mother came into my office with a young man who went to high school with me. He was high on heroin at the time and begging for help. My staff called every state agency and got bounced around until finally we got an appointment that next Monday for help. By the way, this was on a Friday. The mother asked, "What do I do until then?" And the answer on the other side of the phone was to keep giving your son heroin until then so he wouldn't go through withdrawal. That answer is not acceptable. We need a place to go when that window cracks open and someone realizes they need help. Or when someone overdoses and is brought back from naloxone. We need to provide better solutions and ones that allow for true warm handoffs that focus on treating a disease and not an acute situation. For instance, if you had a heart attack, you'd go to the emergency room, where a cardiologist would come, a neurologist, a pulmonologist would all come to check on you. And if you needed additional treatment like a nursing home, you wouldn't be sent home for 4 days and then go to the nursing home. The hospital would keep you until the nursing home was ready to take you. Why should we treat the disease of addiction any differently? We must stabilize individuals and then provide a warm handoff that can provide inpatient residential rehabilitation if needed, not just more methadone, Suboxone, and Vivitrol like the current path we're on. These emergency detox centers are at the heart of the approach we must take to destigmatize this disease, and the Hospitals Association of Pennsylvania has supported a previous version of this bill, and I look forward to them supporting this bill as well. House Bill 2322 is a bill calling for an emergency insurance addendum that would make insurers provide a no more than 2-page addendum to one's insurance that explains how to access coverage and must be written in non-technical language. Access and understanding is absolutely critical for individuals and their families as well. House Bill 2323 is the Mental Health Parity and Addiction Reporting Requirements Bill, which prevents insurers from imposing less favorable benefits on addiction treatment than would be on medical or surgical benefits. My legislation requires insurers to provide transparency on the number of people insured, as well as the number of individuals receiving addiction treatment, an explanation of the treatment, and denials based on these types of treatments. House Bill 2324 is a certification of compliance with mental health parity and addiction, which requires insurers to file a written certification with the insurance department that attests under oath that they have completed a comprehensive review of all health insurance policies and that they administer, and that they are in compliance with federal law. House Bill 2325 certifies sober houses and follows up on the work by the Drug and Alcohol Recovery Houses Task Force, which identifies minimum safety standards for all recovery houses, including a certification for these houses that receive taxpayer dollars. House Bill 2326 is a loan forgiveness for counselors program that would be administered by FIA. It would provide an incentive for Pennsylvania students pursuing higher education degrees to meet the need of quality addiction counseling services. Similarly, we have proposed plans like this for other professionals, including primary doctors, nurses, and mental health workers in the Commonwealth of Pennsylvania. There are few college courses to prepare someone to work with addiction treatment, and oftentimes the best counselors are people who are themselves in recovery, who go back to college, and many of these people in recovery are prominent individuals within our community. I'm also pleased to say that the Educational Opportunity Centers and I have recently partnered, and in my office on the second Friday of every month, we'll have people here to help people who are pursuing to go back to college. It's the first one, I believe, in the state, and I'm excited to be able to announce that partnership as well. House Bill 2327 updates drug education curriculum, which was last done in 1990. and will provide new prevention programs in schools by partnering with the Department of Drug and Alcohol with the Department of Education. House Bill 2328 establishes a Pennsylvania Project Lazarus Commission, which was developed in Wilkes County, North Carolina. I knew it was the right thing to do as soon as I saw the Wilkes County being up here in Wilkes-Barre. In that area, there has been a 69% drop in fatal overdoses over 3 years. Project Lazarus brings communities together and develops plans specific to an area by engaging the community with prevention and education. And working with the architect of this program in North Carolina, who, by the way, is originally from Pennsylvania, I spoke with him yesterday. I hope to bring the similar approach that he has instituted in Wilkes County to Pennsylvania by establishing this commission. House Bill 2329 is a bill to expand drug treatment courts in the Commonwealth, which have been incredibly successful in Luzerne County, seeing just a 4% criminal recidivism rate. You heard that right, a 4% criminal recidivism rate. This would give counties the ability to adopt an ordinance to impose a fee on criminal defendants who are convicted of or plead guilty to a drug crime, which would in turn help to fund the associated costs of drug treatment courts that provide true life-changing treatment options other than jail. House Bill 2330 establishes guidelines to be set by the State Board of Medicine for the use of buprenorphine, often referred to as Suboxone or Subutex, including counseling and behavioral health therapy. We must understand that the drug itself is not an appropriate treatment alone, but requires a more holistic approach to really provide what is needed. The battle does not end today. This problem did not happen overnight, and solving it will not happen in a day either. But we must recognize that even as we stand here today, we are only fighting the battles of yesterday. An extremely potent drug bust of fentanyl happened in West Wyoming just a couple of weeks ago, which is many more times more powerful than heroin. Carfentanil, an elephant tranquilizer, has made its way to Ohio, and will only be a matter of time before it is here on the streets of Luzerne County. And the impending threat of crocodilia, which is in Eastern Europe and Russia, which literally kills nerve endings and skin. We must be more proactive. And I'll begin engaging in efforts to combat the drug epidemic that is on the next horizon. But before we can get to that level, we must win the battle of yesterday and today. And together, we as society will not only win this battle, but begin to win the war itself. Thank you, everyone. I want to thank, I see a number of people out here in the audience, a few people standing here with me, that this issue is personal. A number of the people here to my right have been advocating and working with me on these issues. It's time for the message to get back home to Harrisburg. And I appreciate the people who are here in the audience, the people standing with me today, because enough is enough. People's lives are at risk, and I appreciate everybody being here. I'll be happy to take questions if anybody has any questions.
You have a package of 10 bills. What would happen if some get support but not all of them? How would that work?
I'm hoping that all the bills will get support, but anything that moves forward of these 10, this package would be a step in the right direction. They don't have to move forward as a package. I'm introducing them as a package because we need to put the focus back on saving people's lives. There was supposed to be a special session this fall. The special session still has not been called. The governor said in the press conference on June 23rd he would call a special session. We are several months after that. It's time to call the special session. We've been having hearings all across the state over this entire summer, gearing up for this special session. Every day we go by, it's another 10 Pennsylvanians we lose. Enough is enough. It's time, Governor, it's time to call the special session. We have 12 days left in session for this fall. I think we should spend them focused on this issue. Other questions?
Will the governor find out about this today?
I certainly hope so. Anyone else? I want to thank you for, Bill, yeah, one more time. Yep.
Yes, I think you talked about this a little bit in the speech. Funding the different things in the bills. Can you go over that again?
Yeah, so there are different options of what's going on, but if we talk with our professionals, the way we're spending our Medicaid dollars is not adequate. We realize we're wasting a lot of dollars. There's ways that we can better prioritize our funding using existing revenue streams. Things like drug treatment courts save counties money by not just locking people up. But the thing is, they don't have the money to start up these types of programs. All this stuff, by partnering with our hospitals, with the first bill I talked about with emergency detox, it's about using existing revenue streams and making sure that these services are provided. We need the plan that we have in place right now is only for a one-day warm handoff. Literally, it takes people from an emergency room to one of these centers for excellence where they get put up into a program that would be something for MAT. So literally it is one day because they're outpatient facilities. We just had a hearing in Scranton, the same one I referenced earlier, and I asked the question, have you ever seen, and it was with all the drug and alcohol service providers, including the president, Deb Beck, who I asked this question to, of the statewide organization, do you know of anyone who has ever had successful recovery in one day? Every single person up there said no, and it's ridiculous to even think that. Why are we proposing that as a state policy when the people who are on the front lines are saying this doesn't work? It's time to have a true, engaging conversation and address the issues that we are all talking about, but nobody has taken action on. That's why I introduced this package today. Would I have rather not introduced 10 packages and only done 2 or 3? It would have been allowed me to focus more on just the 2 or 3 things I was trying to get done. But I even have more beyond this that I didn't introduce today because they're slightly more controversial. These are not as controversial. We can get these through before the end of this session. If we get the special session put together, we should be able to get these done. I'm hopeful and confident that we can get bipartisan support. By the way, I have bipartisan co-sponsorship on each one of these bills. It's time to get this done.
I have a question about what you said about the recovery houses. Being in recovery myself, I know a lot of women that they come out of treatment, have no place to go, have to wait on a bed, and wind up going back out there again. So I just wanted to explain a little bit more about how that would work.
We had a task force that was put together for the drug and alcohol recovery houses. The recommendations were put out there, but there has been no action taken on them. My bill codifies what they put together through that task force, puts it all into one bill to create it so that there is actually a stream to help people make sure that they're certified, make sure there aren't people dealing drugs and taking advantage of people who are in recovery in those houses. I'm going to wrap it up there. If there's further questions, please don't hesitate to ask. But thank you, everybody, for being here. I appreciate it very much. Thank you.